Many different countries are in different stages of the epidemiological transition today. Thankfully, no countries as of now are in stage 1, yet some still remain in stage 2. Each stage shows the progress of each country. It shows what their healthcare system and economy is like. Stage 2 countries have a lower standard of such things compared to a stage 4 country. The epidemiological transition model also shows what challenges a country faces. A stage 2 country would face problems like infectious diseases, whereas a stage 4 country would face problems like delayed degenerative diseases. This report shows a country in each stage as well as the progression through them.
Stage 2, Nigeria. The leading causes of death in Nigeria are lower respiratory infections. HIV/AIDS is another leading cause. Citizens of Nigeria also suffer greatly from malaria due to an abundance of the Anopheles gambiae complex, which is a very effective and efficient mosquito that spreads the disease. 1.44% of people from ages 15 to 49 in Nigeria have AIDS. AIDS has greatly affected Nigeria in many ways. It has negatively affected the productivity of families, communities, and even the economy. Nigeria is in stage 2 of the epidemiological transition because its leading cause of death is infectious diseases like malaria. The country does not have good sanitation, nutrition, and medicine, and this leads to the spread of infectious diseases. Nigeria is also susceptible to disease because technology is not advanced since they were under a military rule that lasted 28 years and they weren't focused on infrastructure and healthcare. Nigeria is also in stage 2 of the demographic transition since its birth rates are high and there is a decrease in its death rates. The population of Nigeria is growing rapidly at 26.05 persons per thousand population in 2018. Nigeria has 30 million hectares of land under cultivation at a time. This is not enough as Nigeria needs 78.5 hectares of land under cultivation to feed its people. So through a Malthusian evaluation of Nigeria's population, this data shows that the population is increasing and is currently higher than the amount of land being cultivated, leading Nigeria to be overpopulated and not have enough resources for its population. Nigeria's population pyramid has a big base and a small tip. A lot of its population is clustered in their pre-reproductive years, followed by its reproductive years, and a small amount in their post-reproductive years. As was mentioned before, Nigeria does not have good health care, as there are 0.5 hospital beds per 1,000 people. As well as this, the country only has 0.395 physicians per 1,000 people, further showing why the healthcare system in Nigeria is flawed. Finally, Nigeria's gross national expenditure is $48.395 billion. In conclusion, Nigeria is in stage 2 of both the epidemiological transition and the demographic transition because the country's economy is not efficient and is dealing with infectious diseases. The birth rate is high and the death rate has decreased, leading to a population boom that characterizes stage 2 of the demographic transition.
In India, the leading causes of death by disease are cardiovascular and respiratory diseases. India is in stage 3 of the epidemiological transition stage, which means that most of their diseases are degenerative or chronic, man-made. They are found on the stage because they are just coming out of stage 2 of the DTM and their medicine is getting better, so infectious diseases are dying off. But because people are getting sick with diseases that are human-related, like cancer. AIDS is one of the few infectious diseases still current in India and affects an estimated total of 0.31% of the population, as 2.4 million Indians have AIDS. AIDS has also led to a decrease in productivity in the workforce, which isn't good for the Indian economy or production. From a neo-Malthusian point of view, India should in theory run out of resources as their food source grows a lot slower than the population grows. The food sources in India, which would malnourish many people. The neo-Malthusians predict the right as the population growth line intersects the food production line, that's when wars and famines will start becoming more and more prevalent. For every 1,000 people in India, there are on average 3.1 hospital beds for them. There are 9.29 doctors per 1,000 people in India. The Indian government isn't super keen, however, on spending for healthcare on its people, and there isn't much access to healthcare, being that 70% of the population lives in rural areas rather than urban areas where the hospitals are.
The leading causes of death in the USA is heart disease, cancer, chronic lower respiratory diseases, stroke, Alzheimer's disease, diabetes, and influenza pneumonia. The USA is found in stage 4 of the epidemiological transition because the infections diseases can be treated through advanced medical health care and medicine. Most of the leading causes of death are cardiovascular diseases and cancer, which is delayed by the advancements in medicine and technology. Like everywhere else, the USA is affected by HIV and AIDS. At the end of 2016, about 1.1 million people were infected by HIVs and AIDS. Even though this number is a small amount compared to the overall population, people who are infected are concentrated in certain areas. In 2017, 38,739 people were diagnosed with HIV and 17,803 people were diagnosed with AIDS. AIDS most likely impacted the views of sexuality and homosexuality, as men are more likely to get infected when the epidemic started. HIV and AIDS impact poorer families who cannot afford treatment for the disease and might not be able to work due to the disease, causing poor areas more likely to have more people infected by HIVs and AIDS. In a possibilist evaluation, people in poverty should be able to get free or lower costing health care since they will not be able to afford the medicine they need. Lowering health costs for people in poverty could lower statistics for AIDS. And as urbanization continues to grow, land for farming will diminish. To prevent this, changing unused land to fit the needs of a growing population, the USA modified the land to fit its ever-growing population, seeing as the USA's agricultural density is only 4 farmers per square mile per arable land and 380 people per square mile of arable land. It correlates to the DTM stage and population pyramid because the USA population pyramid is a column and the population is not dying of infectious diseases as much as before, and death rates are low because of the treatment provided. As of 2016, the USA had 2.4 hospital beds per 1,000 people, 2.5 physicians per 1,000 people, and $337 expenditures per capita. Healthcare is not paid mostly by the government. You have to pay for the healthcare or insurance. Although healthcare is accessible and close for almost everyone, some people cannot afford the high costs of healthcare. Oh my God.
Japan has the lowest NIR in the world, reaching numbers such as negative 3.11 persons per thousand population. Cancer greatly affects Japan's population. 248 people out of 100,000 die of cancer in Japan, which would be equal to a total of 1.8% of the population. The NIR is negative because families are having fewer children, and most of the elderly population is dying. Another reason why Japan's population is decreasing is because the country has quickly developed, so family management is more common. HIV and AIDS are not very common in Japan, since only 1,011 cases of HIV were reported in 2018 and 437 cases of AIDS. The theory of cornucopian emphasizes that when a population grows, the available labor again increases. In turn, luxury again increases in correspondence with the increasing profit, and the customs and needs of luxury increase. This applies to Japan because their workforce is in great need of more people. If Japan's population started growing again, they would have a great workforce, meaning their country's economy situation would be greatly improved, allowing people to have more children. Japan has 13.7 beds per 1,000 persons, which is the highest number in the world. Japan also has an average of 2.4 physicians per person, which means they don't have many physicians. Most of Japan's healthcare funds are private, meaning their public healthcare is not the best. Japan is in stage 5 because its population pyramid has a high elderly dependency and a low number of children. In conclusion, the reason why Japan is in the 5th stage of the demographic transition model is because their death rate is somewhat high, and their birth rates are the second lowest in the world, losing only to Monaco.
As you can see from this report, countries are in many different positions. Nigeria is battling with infectious diseases, whereas the United States is struggling with things like cancer. There are a variety of different things countries are dealing with, yet AIDS affects them all. In conclusion, as you progress through the epidemiological stages, healthcare and economy gets more efficient. As well as this, stage 2 countries deal with infectious diseases, but as healthcare gets better, at the epidemiological stages, countries have to deal with diseases that come along with aging. Because the population grows rapidly in stage 2 countries, it is harder for those countries to support themselves with the resources they have, and many of them have a population crisis. Stage 4 or 5 countries have little or no population growth and a better economy. They also have a better means of supporting themselves, so it is easier for them to take care of their population.